Well, I want to begin by recognizing the ancestors and unceded territories of the Algonquin and Anishinaabe peoples upon whose lands I am on today. Um, I'm in Ottawa, what is now known as Ottawas, and it's noon here, but I know it's morning for you folks. I also want to recognize all the territories of the Indigenous peoples whose lands all of you find yourselves on. So hi to them. As you said, Jeff, I'm Nihio from Treaty 6 territory in what is now known as Central Alberta. But I've lived most of my life in British Columbia, so I feel like I have many homes. I've been in BC a very long time. Also, thank you to you, Dr. Mitsuba, and the conference organizers for the opportunity to share with you some thoughts today. So as I was thinking about the presentation, I thought there were three areas that I might offer some ideas in. The first is just, I want to talk a bit about the interconnection between all things, which is a fundamental belief of Indigenous peoples around the world. So I'm going to talk a little bit about that and how I understand that. I also want to share some thoughts on the determinants of health. I'm sure that is a topic that many of you have worked on and are living in your studies. So I'll just share some very brief thoughts on that. And then finally, I want to talk about a model for change that has been useful to me. I've actually used it and wrote about it, and then including a sample of a policy assessment tool that I was part of developing. But before I start into that, I just want to talk about the photo that's that you see here. And you can see that it's a very gnarled and it's a very old tree. And I used to call it the wishing tree. I grew up beside this tree, and I know that my ancestors walked by this tree as well. It grows right by a river where I was a child and grew up. But importantly, under this tree is where I learned to dream. And I think that dreaming is an extraordinarily important thing in the work that we do. I used to look up through those old branches laying on the ground on a warm summer's day and think what the world could be and what my place was in it. And you know, in those times, dreaming gave me hope. And I think that's a really important aspect of the work that we do, not only for ourselves, but those that we serve. And I suspect that we all have our own way of dreaming and our own ways of acting on those imaginings to create change. And so I wanted to share that with you because that's always stayed with me, and it's sustained me a lot of times in the work that I do when it gets real hard. I go to that dreaming place because anything there is possible. Here's one of my teachers, Mary Thomas. She's a Swetma elder from the Nisqually 3 in the interior of British Columbia, and I spent many years with her. And I remember a time when Mary and I we'd go on drives together. We'd drive to the lakes, and or she'd take me into the mountains. And I remember a time we were up on the side of a mountain and we were looking down over the valleys, and she was telling me about a huge forest fire that had been there when she was a child. And she was telling me about stories from her auntie and her grandmother, who both lived well into their hundreds. So when I listened to her, I thought, wow, the stories that she was sharing with me were over 200 years old, the knowledge that they were sharing. And when I would stand beside her, looking over that valley, I felt so connected to the land. It was like you were a part of it. As you stood there, there was just a sense of peace and of silence. It was a beautiful feeling, and you could feel the ground at your feet. And more than that, you could feel Mary's energy just envelop you. And I felt that perfect harmony in space and in place. And it was a beautiful feeling. And at the same time, when you understand that kind of connection to all things, there's a deep responsibility that goes with that. And I certainly felt that responsibility as I stood beside her and I listened to her stories. When I speak of the environment or I speak of the land with people, these are the kinds of thoughts that first come to my mind. I was just at a conference recently, and there was a number of perspectives on climate change and on the environment. And my head went immediately to Mary and those stories and to those places that I walked as a child. And really, it went to a place of relationship. We all have relationships to the land that go far beyond food, clothing, shelter, but it's a place of spiritual connection. And for me, the belief of we are born of the land, we are connected to the land, and we cannot sell it. We cannot buy it. That's the way I was taught. That was our beliefs. We would never sell our mother. Many Indigenous philosophies, I think, have this understanding of being and connection to the land, where all things are connected, even animate and inanimate parts are connected, and that they all have spirit and are therefore alive. Our stories, our protocols teach us how to be in relationship, those things that were taught to me, how I was to be in relationship with one another and all things. And I think about that when I think about the entire planet that we all live on as humankind. It's fragile. And we have a responsibility to it as it does and cares for us. It's a critical part, I think, of the health and well-being of myself and humanity and of the land itself. Another way that I've heard these teachings was from the Sioux people. Have a story about how food was given. And it tells a story. It's a children's book. And I love this story. And it's quite long, and I'm going to give you the Coles notes. But it talks about how each animal laid down its life so that the people to come would have food, clothing, and shelter. And the bear led by offering his life. Then that was followed by spring salmon, by Saskatoon berry, and by bitterroot. All of these beings knew that humans were coming, and they thought about it, and they offered their lives to nourish us. This is called relational being. Even today, when hunters go out, fishermen go out, gatherers go out, they offer prayers and thank the animals and the plants for giving their lives to nourish ours. These are the kinds of things that I was taught. And many children are taught these through stories and through our lived experiences. But all of this is intended to preserve and ensure life for generations to come. I wanted to share just these brief words because I think it illustrates the spiritual connection that exists between people and land. And of course, that interconnection for all of us. The final example I want to share with you on relationship is a quote from Chief Seattle. And it's out of his 1854 speech, where he talks about every part of this earth is sacred to my people. And I quote, every shining pine needle, every sandy shore, every mist in the dark woods, every meadow, every humming insect, all are holy in the memory and experience of my people. We know the sap which courses through the veins of the trees as we know the blood that courses through our own veins. We are part of the earth and it is part of us. The perfumed flowers are our sisters. The bear, the deer, the great eagle, these are our brothers. The rocky crests, the juices in the meadow, the body heat of the pony and all man, all belong to the same family. Will you teach your children what we have taught our children? That the earth is our mother. What befalls the earth befalls all the sons of the earth. This we know, the earth does not belong to man. Man belongs to the earth. All things are connected, like the blood that unites us all. Man did not weave the web of life. He is merely a strand in it. Whatever he does to the web, he does to himself. End of quote. This was a speech that Chief Seattle was giving to government officials in 1854. When I think about these relationships and these connections and these responsibilities that we all have, there's much work to be done, and there's an urgency around that work. We can't turn back the clock of time, but we can share respect for the land and for each other across geographies around the world in order to protect our global ecosystem that we all share. Indigenous philosophies can inform this work and our understanding, not only for Indigenous people, but for all. I'm not going to read you this slide. I'm going to talk a bit about it. I'm going to shift gears here to taking a look at determinants of health and some of the inequities that First Nations, Inuit, and Métis people's experience as a result of the colonial experience, and how this experience really has affected our overall health and well-being. And we all know that these inequities are associated with a colonial legacy of historic, economic, socio-political, and environmental disparities that continue to impact our children, our families, and our communities even to today. Many of these inequities result in a diminished quality of life, resulting in poverty, overcrowded housing conditions, overrepresentation of Indigenous peoples in the correctional system, children in the child welfare system, family violence, and so on. I think a lot of these inequities were really revealed when we all have been living through the COVID experience. I know in the health authority I was working in, we often referred to COVID as the great revealer, revealing the lived reality and the injustices that have underlined some of the vulnerabilities of folks. In order to address these kinds of inequities, we need diverse approaches that are anchored in social justice and take into account different knowledge systems. There's much work to be done. And I think that the teachings that I was just speaking of blends and gives us that underpinning and understanding of the connection and relationship. And so that we need approaches that are going to take into account the complexity and the intersectionality, the cross sectors, cross disciplines that we need to think about when we're thinking about our health and well-being. And that really underpins how I have long thought about the determinants of health and the social determinants of health. In 2009, when that was just really coming to the forefront, was through Marmot's work, Sir Michael Marmot's work. I often equated that and thought back to some of the teachings and how that, for me, underpins my understanding of the determinants. I think a determinants of health approach really offers us a way to think about very complex realities that we're working in. And public health is complex. It's nuanced, it's complex, and there's lots to think about. Um, Here's a list of determinants. I know that you all know these lists, and this is just one example of many, many lists. But I wanted to offer this up as some of the considerations when we think about the work that we do. We also have, I've done work on very Indigenous specific determinants of health. And you can see here, colonization, residential schools, colonialism, self-determination, language and culture, and so on and so forth. So I know that I'm sure all of you have taken had these kinds of conversations in your studies over the last while. But they're really important to consider because for First Nations, Inuit, and Métis people, all these things apply. And I think that's really important. And it takes the sort of more traditional, if you will, I use that very broadly, lists of determinants and adds to them that sort of spiritual in geography perspective. So I wanted to share that. And I think, but when I think about this, I'm thinking about this as an approach that can get us to the complexity of what it is that we're trying to look at. So here's a model that we developed at the Collaborating Center that certainly tried to look at. It was based on a belief too that there are multiple ways of knowing and being in the world. When we look at the globe, we only have to look at the diverse cultures. We can look in our own country for diverse cultures. I'm not going to go into great detail on this, but what I do want to say, and I acknowledge that there's many, many models of that are used for the determinants of health, which I could share with you, but I really wanted to highlight that beige circle that says interfaces, because it really points to that we have different systems of knowledge, different ways of being and seeing the world that often impact our work when we're working on public health challenges, issues, and successes. When we're working on that, of being mindful of that, and really looking at Indigenous ways of knowing and being, and that's where the central orange piece on this model is. But knowing that whatever happens to at those levels for Indigenous children and families is really also impacted by a much broader context. And so that's what we've tried to illustrate in this this diagram or this model, if you will, and you can see all the determinants situated around it and how they impact across all of these systems of knowledge and impact right down to communities and individuals' lives. So I just wanted to share that with you because it's complex. And we might only be working on one little thing within that complex circle at a time. I know that's what that's the way I have found myself doing the work. So here's a model that's really thinks about change. And I actually developed this, and it really comes off of the ecological model, Bronfenbrenner's work in the late 70s. I remember reading his stuff way back when. Now I'm really aging myself. But I did study those things. But really thinking, and so when I was thinking about it in the work that I was doing, is that outer circle, what are the big structures that really impact our lives? So legislation, policy, societal norms, beliefs. I mean, when we start to think about racism and cultural safety and all of those kinds of things, I mean, we're talking a societal change there. And how do we do that? We also are looking at systemic determinants. So there's lots of systems. I worked in the health system. So what are the policies that are guiding those systems? And Are they inclusive? Are they respectful of all peoples? And then, of course, in the middle is the determinants. And honestly, when I was in the health system, that's where we would think about our practice. How am I on a one-on-one relationship? How, as a practitioner, how am I in relationship with those that I'm serving? And a lot of times, the systems policy would guide how I did the work. And of course, that's always influenced by the bigger structures that are in play. But really, those structures and those systems are intended to support good practice. So, at the individual level, particularly in a health system, how do we support that good practice? And so when I look at this, I used to ask myself, so where am I in this? Where is my sphere of influence? Am I at the practice level? How can I influence at the practice level? Do I need to talk to people who are writing policy, or can I help them to write policy? So asking ourselves, where are we? I was in a healthcare system, but I was at the level where I could create policy. So I found myself in that sort of systemic change place where I had that kind of influence, but it was always designed to support good practice. And then how do we influence the big legislative structures? Is it through our unions? Is it through our professional associations? When do I advocate? Those are big questions, but we all have a role to play from my perspective. And so we ask ourselves, where am I in this change? And what's my role? And who else do I need to help me with that? I know those are huge questions, but we can apply specific determinants here. And I often have done this because in my world, I really have spent a lot of time and doing research on early childhood. So I would look at what are the best practices for children? What are the people telling me they want for their children? And so that's at the practice level. If we had a Head Start program, a formalized program, what is the best care? And what should be guiding me? And then I look at the systems. Is there enough resources to support that practice? What is the training that's happening for people who are caring for our children? And that's at that systems level. And at that structural level, then what is the legislation? What's the provincial legislation guiding the care of children? How are people being credentialed? And how are programs being looked at? So I would ask myself those kinds of questions when I was thinking about change in this current reality. My last couple of slides here have to do with a document that I was part of a team in creating. And it's a policy assessment tool that we created within Northern Health. It was a team of individuals in the Indigenous health portfolio. And it took us almost 2 years to develop this tool, and it was all around cultural safety and system change. So how could we ensure that the policies that were being developed were respectful, and that we could look at past policies and any new policies, and that we could ensure the cultural safety of those that we serve. And it was really a tool to support healthcare professionals. And it was focused on Indigenous peoples, First Nations, Inuit, and Métis, and how could we be inclusive and respectful of those individuals and communities in the development of healthcare initiatives and policies. And I'm just going to show you some of the decision-making trees. There were the primary the essence of this document is based on 4 decision-making trees. The first tree was called Engaging Indigenous Peoples. And there you can see it. And so people would have are thinking about developing policy, and they would start to think about the first question: is this initiative going to impact Indigenous peoples or communities? So they would say, yes, it is, and they would follow that decision-making tree. Or no, it's not directly impacting them or indirectly impacting them. And they would have to have a discussion about whether that was the case or not. So you can see there, I'm not going to read out this slide, but I can certainly give you the link so that you can go online and access this tool yourselves. But the first step was, should I be engaging Indigenous peoples? I know how we would answer that off the top of my head, but when you're using a specific policy, you'll want to go through this. The next one was how, I went too far. I went too far. Ooh, I did. Sorry, folks. There, sorry. This one gets to health equity through access, and it really focused on access and are people able to equitably access services. And this piece also adheres to principles of LOCAP to ensure any data that was being collected, access that related to access, that we ensured the ethical collection, management, and use. So there's a lot in this particular decision-making tree. I'm going to keep going because I'm not sure about time here. This third decision-making tree was ensuring Indigenous inclusion. And so at the very first one, we asked, should they be included? And then this begins to ask, were they included, were First Nations, Inuit, and Métis people included in a way that met their goals of inclusivity? Did they feel included? Did they participate in a real way? Those kinds of questions. And of course, I'm not going to go through all of these. And the last one, of course, is always evaluating and reflecting back. Did this tool do what it said it was going to do? And I think in here is it's like reciprocal accountability, where we are accountable to those that we serve. We want to hear from them. Did we do what we said we would do? And has that been a benefit to you? And I think that's really important as well, to reflect back on what we've done. And if we didn't, then we get an opportunity to change. And I think that's really important. I'm going to stop there. I don't know how I am for time. I didn't time myself. So I'm going to stop there. And I absolutely welcome questions or comments. I'm happy to, I will try to respond in the best way I can. As I was telling Jeff earlier, I don't have a whole lot of answers. I have a whole lot of questions. Anyway, thank you for listening to me. Hi.